Okay. Hi Arun and Happy New Year, Happy Pongal, Happy Matu Pongal, Happy Valentine's Day. Okay, so also
hello Unni, hello Sonali, and very, very happy new year.
Hi Arun, good to see you after a long time.
Yeah, and also happy Prosthodontist Day. So now that gives me the question for all the people who are uninitiated. Okay, please clarify what an orthodontist means and what a prosthodontist means. What is it? Quickly.
Okay, see, dentist, dental surgery and dental specialty has got many subspecialties and super specialty.
Okay.
To be exactly what a prosthodontist does, see, prosthetics is anything that is an artificial replacement. So a prosthodontist replaces tooth associated structures. It can be the gum, it can be a portion of the lip. A maxillofacial prosthodontist replaces sometimes the nose, eyes, ears, based on the trauma. So a prosthodontist is someone who replaces tooth and tooth related structures. So that's what what a prosthodontist does. So it's an additional training that happens post our graduation, which is like a 3-year super specialty training which happens. So we get trained in this field, and after that we gain experience in doing a lot of work. So that's who a prosthodontist is.
Okay, so just to give you a brief about the Excellent Speak series, we started this sometime last year after we felt that too many people were talking only negative things about pandemic, COVID, so we thought that we'll just get professionals who are excellent at different fields to come and speak, so that it reaches across to a mass audience and says that, boss, there's an ups and downs, and so we need to kind of cope with it. So that's the idea. So today is the 15th of January, and it's also the Indian Army Day, and also the Prosthodontist Day. So, and it's our 15th.
That's 22nd Jan.
No, Indian Military Day is today. The Army Day is today. And also 15th kind of coincides with the 15th episode. So it's kind of fell in neatly. So the first question that I have for you, Arun, is that you've had a long run as a specialist and an entrepreneur in the field of dentistry, of course. So in your opinion, how has the medical fraternity reacted to the COVID pandemic? That is in general, okay? And in specific, how are dentists handling this particular thing?
Okay. To answer the first question, how the medical fraternity has handled it, I would say, see, when the entire pandemic started out, so that's way back, almost a year back, we were also having a medical fraternity as a whole had a very little knowledge about what this pandemic is. So there were a lot of apprehensions about getting the treatment modalities right. Patients were presenting with varying symptoms, so they were not able to come out with the right course of actions for a different manifestation of symptoms. So if you look at COVID pans out and entire symptoms, there is symptoms of the GI tract, there are symptoms of course the chest, so primarily a respiratory infection, and with varying degrees of severity. So I would say, so there was a lot of research development that started off during the first quarter of the last year, and then they are streamlined the entire treatment planning process. So if you look at it, India as a whole, as the medical fraternity has actually come around very well, and then formed as a team, and then they are they are dealing with this pandemic very, very well. So that's the reason, if you look at it, in terms of statistics, we are in a much better position when compared to the other countries across the world. So medical fraternity first took time to understand what it is, then develop the different protocols based on the presenting symptoms and what was working, what was not working, and then with a lot of research coming in also, and they have fine-tuned their the response to this entire thing. So and also the government machinery also setting up the process has done very well. In terms of dental specialty as a whole, so if you look at it, initially we were also apprehensive about because if you look at it, anesthetist is one profession where they come in contact with the cough or the respiratory, fluids directly. The next would be the dental surgeon, because our line of work is in the patient's mouth. So they are always the patient's mouth. So we are always, in line of whatever the saliva pathogens, also the respiratory pathogens.
Yeah.
So initially there was a lot of apprehension in terms of how are we going to structure the operatory, how are we going to structure the patients, how are we going to structure the entire, the flow of patients is going to be there. So we then, over a period of time, developed a protocol, whatever that needs to be done in terms of the standard operating procedures that needs to be evolved, in terms of infection control, in terms of patient management, in terms of appointments, and in terms of post appointment disinfection that needs to be followed. So once we developed this protocol in place, and then once we started following the protocols, and pretty much the dental people have also started seeing patients now. So in terms of it, there was an initial lag that was there, because all of us were confused, right? All of us were apprehensive whether to start seeing patients, multiple informations flowing across different spheres. But once those information settled down, we are able to figure out what is the norm that needs to be followed. Then we started, adopting the best practices, and then from that we have taken it forward.
Yeah, I think that I need to share with you guys. Yeah, you medical guys. I mean, the amount of commitment that you guys have, the way you approach this whole thing. I think you need to really, give a whole lot of testimonials to all of you guys. So, and that of course includes the fraternity, the dentistry also.
So the next question is from me, Arun. So the pandemic has affected.
Yes.
The pandemic has affected all elements, whether it is individuals, organizations, institutions. Your work has given you, insight into what people experience. I mean, it has given you insight into what all people experience, right? What do you believe should be the simple steps for them to stabilize and get back to normalcy?
Yeah, see, of course, across the spectrum, I have had people, losing their loved ones. There has been, from friends, family, known people who have lost their loved ones to this entire pandemic. There are multiple people who have lost their jobs, and because the entire, be it the tourism, the travel industry, across different spectrum, there have been people who have lost their jobs. It has actually turned all our lives, 360 degree, completely, the way we work, and children not going to school, at home, trying to learn the entire thing online, and even IT professionals working from home, be it the travel, tourism. So it's across the spectrum. There's been healthcare facility included. They've undergone a 360-degree shift. So if you ask me what is that one thing that needs to be done, is I would always say that now that we have understood what this is all about, is if we can then count our blessings, and then get in touch with whatever the core our specialization is, and then try to work from our strengths and with counting our blessings. So that would be the first step forward. So still, it's always, there is always some, definitely there is light at the end of the tunnel. So we can all see that. And so just, to, focus on our strengths, count our blessings, and then keep moving on. Take that one small step in the right direction is what I would say would be the, the best thing. Even though we are not able to see the entire journey ahead, can we take one step in that direction of where we want to reach? And as we keep taking those multiple steps, we'll eventually be able to see the road ahead completely. So that's what I would like to say that.
Yeah.
Start with gratitude. Start with gratitude first.
I hope yes. I hope I answered your question.
Yeah. So start with gratitude first is what you're saying.
Correct. Yes. Yeah.
Actually, you kind of, really, caught on to the points that I was coming to in my next question. Okay, the fact that it's affected the political sphere, the economic sphere, all of those things. So, like you say, this, light at the end of the tunnel is for individuals, organizations, institutions, all of them, So, coming back to the recovery mode, moving back into normalcy, I just wanted to know in your medical profession related question, okay, what skills do you think, I mean, see, we have done a lot of work together, in skill development, isn't it? So, what skills do you think medical professionals need to adapt quickly for them to move ahead in the future?
See, one thing, I would put it this way, right? So one is, I'll speak in specific to dentistry if I'm saying that dentistry itself is extremely specialized profession, right?
Yeah.
So it's highly skilled work. And since it's extremely specialized, there are two components. As if every dentist, or for that matter, every medical professional is going to become more skilled in the core area of their work. It means that if I'm a prosthodontist, if I'm going to get more skilled in that, if I'm going to enhance my skill in my core specialty, do what I'm extremely good at, and then keep focusing on it, and and enhance my skills in my specialty. So that will be the first thing that I need to do. Extremely get more, very very professional, very thorough in my skill, increase my knowledge. There's very wide range of information that's there. Pandemic, one good thing about the pandemic is it's opened up a world of education. There's webinar happening, online trainings happening, multiple education happening. So before it was, we were all close to that. What's happening in another country across the world, it's available right, sitting, in our workplace or at our home. And we can, through our smartphone or through the computer, we can learn from it. So the first thing is to become extremely professional, extremely skilled, to upgrade the skill sets that are there. So that will be the first step. The second step would, the important step would be to work on our communication skills. Understand because the people whom we will be, at the end of the day, we have to interact with people. We need to move with people. We need to help people. So we should know from where they are coming from, because in the last 1 year they could have also gone through in terms of professionally, personally. So we should be able to understand from where they are coming from, and then if you're able to understand from where they're coming from, and then give them what is required for them, what will be the best for them. So that these two things, one is upgrade yourself professionally, upskill yourself, increase your knowledge, increase your skill sets, and understand from the other person's perspective, so that you can give the best what you have to the best of your ability to what is actually required. So this will actually win-win for all concerned.
No, bilkul. I mean, it was just pat on the point. Absolutely right. In fact, I think you also know we were the face-to-face kings. I mean, we could handle any program if we were present there. And then this whole thing, the NIFT program, like I was chatting with you, where they asked us to shift completely online. We didn't know what Zoom was. We had never heard of what Zoom. We know only camera Zoom types. Okay, so now if you ask us, I mean, we have kind of upgraded ourselves. Zoom and all has become like the back end left hand operation kind of thingy. In fact, it's opened up a vista of opportunity for Excel also, because we are reaching out. We are doing a program for the Malaysian. It's called the Unitar International University. We are doing faculty programs for the student program. I mean, the whole vista is open. You're right. I mean, we need to adapt. We need to quickly upgrade ourselves. There's no doubt about all that. Sonali, are there?
Yes.
Yeah.
A video.
Yeah, you put it off.
Yeah, you can.
You've turned it off.
Yeah. There you go. Yes. So, yeah, Sonali, you can ask the next question.
Yeah. So, okay. Now, where is my, yeah, yes. Okay, so as a parent and as a leader, Arun.
Okay.
What abilities should we inculcate? What ability should we inculcate to be of value as better citizens?
Okay, that's a very interesting question. As a parent and a leader, what ability? See, there are, okay, I would put it this way, right? So especially um, with children at home, and
Yes.
the parent has got even more time to interact with their children, know their children better. So that's one, that's one blessing which is there. So which we can interact with our children, understand what they are, understand what they are going through also. So if you ask me what is the uh, thing that needs to be inculcated as a parent, I would say two things. One is every child should feel extremely good and competent about themselves. They should feel that they are very good in whatever they are. Each one's strength might be different, but every child has got a unique strength. They
Correct.
need to dig deep enough to find out probably, and probably they, give the children the option to explore, come up, do things, make mistakes, learn from it, and finally they'll be able to find out what they are good at. Once they
Yes.
find out what they are good at, they should have that sense of uh, I won't call it arrogant, but the sense of one thing that the feeling of being good at it gives you a sense of a confidence that's there. So
Yeah.
once that is that the child identifies that, what can happen is when they know that they are extremely good at, it can also raise their arrogance level, ego level.
Their
The
confidence
second
level.
quality that should, yeah, so second quality that should get inculcated is being empathetic to others. So then it means
Yeah.
that I know that I'm extremely good at, but I also respect what you are good at. I can understand
Yes.
your point of view. So I know from
Yes.
where you are coming. So if these two, getting ourselves being very good at whatever we are, and also being empathetic to others. So then it becomes like a very, very unique combination in a child, right? So I know that I'm
Yes.
extremely good. I'm super confident, but I'm not arrogant at the same time. I'm very proud of my ability, but I don't have pride to blind my eyesight. So then it
Yeah.
gives a very good balance. So then it means that I know from where you're coming from, but I also, so then it becomes a very good platform for children to learn, grow, and also when they grow and into adults, it also helps them to interact in a bigger environment of adult environment of knowing their importance and also giving importance to other people too. So
So
that's what I would say that as a
I know
parent.
what I'm good at, but I'm also encouraging someone else's strengths, is what you're saying.
Correct. So being good at what you do, so being very
Yeah.
competent and also being empathetic to others also.
Empathetic to others. So, okay. Excellent.
Okay, so this is out of the syllabus question. Okay. Now there is all this spending more
This is
time.
dentistry. So
No, more interactions with people can either work this way or that way. Okay, so now that people got more time to spend with their families, with the children and all of that, did the bonding increase or did the bonding reduce?
I would call it this way, right? So see, it's not that, there is always every coin has got two sides, right? Heads or tail. The question is which side you want to look at. So if you're going to be at the same room with 4 or 5 people, so you will see the ugly sides too, which is there. The question is, as a parent, or as a senior member of the family or senior member of the organization, if we are mature enough to see what is not okay also, but focus on the good things, then we have a better life for us and also for others. But if our eyes are only trying to pick up all the nonsense that's also part of all of us, so then we will end up throwing muck at ourselves, right? So basically, it's both ways.
Very, very diplomatically you answered, right? I spun a googly question to you.
But the fact is that, right? So it's like, it's not a diplomatic answer, because I can only speak from my experience, like so it's like and also because I've heard there's a lot of issues that, especially with social media, WhatsApp University happening, and there's a lot of problems happening, and there are things that are happening not so good. Because see, you should understand, um, people getting exposed to all these smartphones and all these online things, not going out, not getting fresh air, is also, and also not able to meet their friends, family, go out, is also bringing a lot of stress to them. In terms of children, there is stress. Adults are undergoing stress in terms of extended work hours, not having definite time before, so this is adding to the stress. So if they're not very clear about, going back to their roots and then trying to, get in touch with nature or get in touch with themselves, it's going to create that kind of the discord you're saying. So, but if you're able to, go back to our strengths and then take the next step in the right direction, I think all of us will have much better lives.
No, why I asked that question was because Sandhya also is a professional and a mother, okay, and you have two young children, boy and girl. So all of those things that come with it. That's why I asked that question. Anyway, so one final question for you.
See, what happens? What happens? Oh, done. Sorry. Yeah, please go ahead.
The final question is that, okay, do you have any message for the younger generation? That could be your children or it could be children of others. What is the message you would like to give?
And the slightly older children. Your children are very young. The slightly older generation, maybe the young adults. What about them? What is the message?
Okay. See, one is I'm actually too young to give any message to children. So I would listen to some message.
We are all there. We are all there.
So it's like you ask me to give a message to children. You make me look old and feel old. So which is one. So in that okay. So now. With whatever I said, the message is probably, I would say that you're never too old to learn anything new. I would put it that way. So, and also, so it's like, so whatever be your age, if we can keep ourselves open to learning, keep ourselves open to possibilities, so we will, our, life keeps opening up newer dimensions, newer possibilities, which we can explore and then embrace. So that's typically for our, we children. So it's like the older children, which is there. I'm not sure what age group you're speaking about. For the young adults, if you call those young adults adolescents, sometimes it might be difficult to listen to somebody who is much senior. But I think they have a wealth of information to pass on. I think it's always, keep yourself open. So you might pick up some really useful wisdom. So keep some ears open to those so-called mature adults. So probably they've got definitely useful wisdom to share, which you can pick up. I would say that you need not necessarily, because if you ask young people to really do this, do that, probably they might not do it. My suggestion to them is, you need not follow what the elderly say, but can you be a student, listen to what they say, apply it and see if it works, it works. If it doesn't work, you at least know one way of not working. So at least you have tried it out. So that would be my message.
Okay, so
well said, Dr. Arun.
No, if I have,
thank you so much.
Where I to kind of to close, if I have to sum up the whole thing, there is really no age. You're never too old to learn, and if you're not open to learning, you're too old already. Anyway, thank you so much, Arun, for joining us, and I think it was a very interesting discussion.
Pleasure.
We had enough of gyan and enough of laughter too, and glad that you're part of the.
And let me finish by saying, yeah, I think Unni has got.
No, I'm there. I'm there. Sorry, the question didn't come through, Sonali.
No, I got stuck, I think.
Yeah.
Okay, so no, I wanted to say you better stop saying day to him, because he's come in his scrubs and you better respect him. He's come in his scrubs. He's Dr. Arun for the day. Stop calling him day.
So, Yeah, for us, it's all mishmashes. Day, die, ebrarga, die, all that.
Yeah. So respectfully bid him goodbye and say
Thank you
thank
so
you.
much. Okay,
Arun.
I will do Corona greeting. Namaskaram.
Yeah.
Thank you very much. All the best.
Thank you very much.
Bye bye.
Thank you. Bye, bye,
Thanks,
bye,
Arun.
bye. Thank you so
Bye.
much. Bye, bye.